अपनी तरफ से चाहे कम्युनिकेट कर सकते हैं, ठीक है? ही इज चेकिंग द स्कोप, यू बेटर बी देयर. So why are we doing it again?
अस्सलाम वालेकुम इम्तियाज़, कैसे हैं आप? क्या हाल है? मुआयना स्टार्ट कर रहे हैं, परेशान ना होइएगा. मैं आपके स्कूल के एरिया में ज़रा सा दवाई लगाऊंगा, ठीक है?
Daily. I was letting him do the DR.
मेरा साथ कीजिएगा, माजरत और सॉरी.
लाइट ऑन कर दो, लाइट ऑन कर दो.
I'm just going to give the history. So good morning and I welcome you all for the Train the Trainee course. This is our first patient that we'll be doing. It's a young male with complaints of bleeding, PR and constipation, and there's suspicion of internal hemorrhoids, so that's why we're doing his colonoscopy. The hemoglobin is 14.4. He is well prepared and he is well counseled about the procedure. Thank you.
Let me know if you need any help. मैं आप in the back, ठीक है? You might want to check the water jet as well. So if you could freeze the camera, yeah. Good. You can insert it.
इम्तियाज़, बस मुआयना स्टार्ट करें.
So usually during the procedure, मेरी advice ये होती है to use minimum air for the procedure. So you can keep your finger off the air button and let me know if you have any issues. So you keep your finger off the air button. Right. यहाँ पे थोड़ा इंसफ्लेट हो रहा है, तो आप एयर के बटन से बिल्कुल अपना फिंगर को दूर कर दें. अब ठीक है? Okay, अभी lumen दिख नहीं रहा. So would you like to see the lumen a bit? Let's just find out where we are. Okay, good. Suction a bit. That's fine. Right. So, okay, you can hold up, stop for a minute. So what we can do is, in this point, if you don't mind my interruption, we can turn the lumen a little towards the 12 o'clock. So अगर आप इसको 12 o'clock पे लें and minimum air, and you can even use your water jet. Yeah, so, yeah, you can just clockwise torque it. So you're anti-clockwise right now, right? Clockwise करें, anti-clockwise करें आप अभी. So you can move your scope a little towards the bottom. So if you just pause for a second, I'll show you. You keep the scope in your hand. You relax the scope over here, and you can keep the body of the scope a little to the bed. So this way, your alignment of the scope is good. And if you just move your scope a little towards down, okay, then you're seeing that it's going anti-clockwise. And if you move it towards your chest, yeah, now it's going clockwise. So let's try to use these maneuvers, and you can suction a little bit of the fluid because it's blinding you. And again, keep your hand off the air button so that you don't end up insufflating the proximal colon. Okay. Now, try to steer it anti-clockwise and bring it a little towards 12 o'clock. Yeah. Yeah. Try to keep the lumen in the vision. Good, good, good. The patient's getting a bit uncomfortable. Okay, so you can suction again. And suction, go back a little bit. You can see the scope that you can. There's a bit of a loop over here, that's fine. But suction over here. Move the scope all the way down. Maintain this nice angle so you can keep your hand uncomfortable. Anti-clockwise and move the scope a little towards the bottom. Yep, go ahead, go ahead. Suction, move it towards the bottom. Torque it. Right. Okay, keep torquing it to the anti-clockwise. Sorry. Are you able to progress? No?
It's a little hard.
A little hard?
Resistance is there.
Okay. If at any point you want me to take over, you can just let me know. But you can try right now. So you go ahead. Okay, suction it. Okay, now you clockwise torque it, anti-clockwise. Yeah. And you progress. Pull the scope back a little bit. Pull it back a little bit. Right, not that much. Okay, so you have a loop over there. That's why it's bothering you. So you've de-looped it. You just suction a little bit. De-loop. No, not. You're getting me closer. So you can use a water jet here. Water jet use कर लें. थोड़ा सा scope को आप अपना पीछे ले लें. Good. अब आप progress कर लें. थोड़ा सा advance कर लें. Right, good, good, good. Now, advance it. No air, okay? And you just anti-clockwise. थोड़ा कर लें. Okay, so you're having some issues, right?
Yes.
Do you want me to take over?
Yes, perfect.
Or let me just see if I can explain it to you, and then I'll show you how to get it done. So what we can do is, as you can see that the shaft of the scope, it was a bit, you need to keep it comfortable, right? And this is the movement that we're going to be using, and I'm just demonstrating. If you look at 50, this is clockwise, okay? It's going clockwise, and this is anti-clockwise, right? We're going to be using this maneuver predominantly. And right now, if you see our scope guide, our scope is straight, right? So we're keeping our hand, let me just see where we are. So you can see that, I think the main issue is that there might be some liquid stools that are obscuring your vision as well, right? So we'll try to suction that, use a little bit of air. Now I know I have to go here. And I'm just moving my big wheel tip up. And now I see that the lumen is ahead, right? So I will slightly move the scope a little to the back, and I will keep my steer to my maximum use. I'll see if I can progress ahead comfortably, and I'll check the patient. Does he look fine? Okay. So this is where I'm supposed to be advancing, right? So this is me using extreme anti-clockwise torque, and let me see if I can advance it inside the lumen, because it might be that the preparation is giving some problems, right? So let's see if we can advance it, and I'm going to try to use the water jet to get me through. There is a bit of a bend here, gonna use a little bit of the loop to get ahead. If the patient is fine, let's keep an eye on him. Right. पेशेंट ठीक है, हल्का सा पेन हो, गहरी सांस ले आप। This is a bit of a sharp bend, right? We're going to try to move it to 12 o'clock. So I myself am a bit blind here, so I'll go back. Now let's try to move this clockwise, all right? Patient ठीक है? All right. So it seems like it could be that we have a little bit of air, and that might be contributing to the problem, but we'll try to get ahead of this. Slowly suction a little bit. And I'm going to use continuous water jet here to see if that helps. Okay? Now I'm a little blind, so I'll stop for a second. Now I know I'm supposed to go there. So I'm going to try to torque my scope a little towards the clockwise to see if that makes it a little better. Right. So I've managed to bring it to 12 o'clock. I need a little bit of air, but we're still at the same bend. Pain हो रहा है? थोड़ा सा आप गहरी सांस लें सर, थोड़ी deep breathing, गहरी सांस. Okay. Yeah. This is actually a pretty sharp bend, and that is causing some pain to the patient. So we'll use a water jet here, and I'll try to reduce my scope. Pain हो रहा है? Okay, so this is a bit of a tough one. Okay, हम पेशेंट को कितना दे चुके हैं? All right, so let me see if I can get us out of this. So that is my own scope trauma, and let me see if I can just reduce it. I brought it up to 12. आप ठीक है? I'm going to use the water jet. Pain हो रहा है? Sorry sir. आपका बस हम लोग करने वाले गहरी सांस लें. Paul, I'm actually struggling with this bend. I won't lie. I don't want him to cause any pain, but would it be too early to do that? Would it? You want me to move him all the way to his right now? Okay. तो patient को पूरा मेरी तरफ right कर दो. Let's just get through this part, and I'm going to give you the scope back, and then maybe we can explain the principle behind what's going on. मेरी तरफ करवट दे दो. इस स्कोप को देखें. थोड़ा सा गहरी सांस लें. Can we have some gel, please? So the position over here is a bit atypical. Progressing the scope might be a bit hard, so we're going to try to do that. As you can see, probably what happened is that there's a lot of hair on that side. The patient is a bit thin, and we have to keep in mind that we don't want him to have any pain. And right now we're probably at the splenic flexure, which is why it's causing it's an acute angle. So to progress, I'm going to try to keep my scope as comfortable as possible for him. Now I know I'm supposed to go at 3 o'clock, but I'll try to maneuver it. Yeah. Okay. It just rolls. Yeah. Yeah, it just rolls over here though. I'm going to try to move it a little to the left.
Yeah, the fold itself is going this moving in this direction.
Yeah.
That's where it is. We're going to hold it in the
Yeah.
lift that.
Okay. I can just give it to you again. So yeah. Go ahead. Can we move the patient back into a more comfortable position? We can move him back to left lateral if you don't mind. पहले शिफ्ट कर लेते हैं, then I'll सर आपको वापस सीधा कर रहे हैं, ठीक है उस तरफ. Okay, you can have the scope. Sorry about that interruption. So that was a bit of a hard passage, but if you can just bring your lumen back to the center. Yeah, you can go in. Suction. A little bit, just a water jet. Use the water jet, yep. Water jet. And keep your finger off the air. Okay, you can just react. Good. Okay, so stop. Let's just peek in. That is alright? Okay, so if we stop over here, the patient is a bit uncomfortable. So you can just take some air out. You can take some air out, keep the lumen in the center so you don't suck any mucosa, just a little bit. And you use the water jet simultaneously so your mucosa doesn't get stuck in the channel. Right. So take some air. Okay, so when you're advanced, is it a 1-to-1 movement? Is it? I think you have. Right. Okay, so you can slowly advance ahead. Is it a 1-to-1 movement?
Yeah, I feel like that.
Okay. All right. So. Good. Okay. So you can see on the scope guide that you have a bit of a loop. And good, you're reducing it. Brilliant. Lumen in the center. So that's a bit of a loop, right? Okay. Good. That's how you. So you have to have smaller movements when you're de-looping. So bring your lumen to the center. Okay. And it's not a 1-to-1 movement anymore because you're falling back, right? So would you like me to give you a suggestion on this? Okay, so if when you do big movements like that, there's a big chance that you'll fall back and the patient might feel some pain. So what you need to do is just keep your lumen in the center. Yeah, this is the scope falling back. So just suction a little bit. Right. Advance very slowly. Very slowly. And keep a clockwise torque. Again, pull back a little bit. Very slowly. You need to advance a little bit. Okay. So if you do a clockwise torque, clockwise, right?
Clockwise or
So
anti-clockwise?
clockwise, just a little bit of clockwise, and then you pull the scope back just a little bit, and then stop, and then go ahead. Suction a little bit, just a little bit, so you don't get any mucosa. Okay, stop. Now keep your lumen at 12 o'clock. Slowly, progress very slowly. Good. Now over here, do a bit of a clockwise torque. A little bit, and just pull back a little bit. Good. Now go ahead. Advance the scope. Suction a bit. Good. Not too much. You don't want the mucosa caught. Okay. Now do a slight. Advance ahead. See if you're going in smoothly. The patient's fine. There's a loop. Okay. So now you stop. So now you do a clockwise torque, or try an anti-clockwise. Which is easier, a clockwise or an anti-clockwise? Okay, so if you do an anti-clockwise and you slowly pull back, So if you pull back that hard, then the patient might have pain and you might end up having some mucosal injury. Now look back at the center of the lumen. Good. Okay, so your scope is shortened, right? So now show me the lumen. Suction.
Hello, if somebody could be ready as part of the faculty to take over.
Blindly.
We've got 5 minutes left.
Pull back and keep the tip
5
up.
minutes.
Good. Suction a little bit. No, you have some mucosa. Use a water jet. Right, that's mucosa suction. All right. Okay. Suction. Slightly. Not the mucosa. Are you able to advance it ahead? Okay. So you can just do which torque is easier? Are you finding it easier to do a clockwise torque? So do a clockwise torque, or is it less resistant on the anti-clockwise? Anti-clockwise is easier for the scope. So do slight anti-clockwise and reduce the scope. Pain on it? Okay. That's okay. Stop. That's okay. Stop. Clean your lens. Suction a little bit slowly. Okay, that's enough. Reduce the air. Good. Now try to progress a little bit. Are you able to progress? No. Okay. So just stop. And now do an anti-clockwise torque and pull the scope back a little bit. Anti-clockwise, stop, then pull back. Okay, that's okay. Reduce the air. Good, good, good. Okay. Good. Now, slightly clockwise and then pull back. Slightly. No, not too many big movements. Not too many big movements. And keep this lumen right in the center. Right. You're doing anti-clockwise, right? Right. Reduce. Pull back slightly. Right. Pull back slightly. Okay. Now hold. Stop. Stop. How's your scope right now?
It's okay, but it's not too free. I think there is some producing.
Okay, so you can, right now, are you feeling easier to torque it clockwise, or is it easier to torque it anti-clockwise?
Clockwise.
Clockwise? Okay, so just slight clockwise torquing and just 1 centimeter, 2 centimeter pull back. Good, but enough. And then go back. Don't let go of the torque, okay? Don't let go of the scope. Now, progress ahead, advance ahead. Are you able to go?
1 minute.
Slight clockwise. Okay, so we have 1 minute to the procedure. Slight clockwise and slight pullback. Slight clockwise and slight pullback. Just one step at a time. Good. Keep doing it. Keep doing it. Your scope will straighten. Keep doing it. Keep doing it. Slight clockwise, hold, pull back. Slight clockwise, hold and pull back. Can you feel the loop coming out? Can you feel the loop releasing?
Yes.
Good, good. Now, we can actually change the position of the patient right now because we're reaching the right side of the colon. So if you make the patient lie down on his back, we should be able to get inside the cavity very easily. Sure. So, oh, that went terrible.